now we're going to show you what blood flow restriction is. And so here's my unit. This is the Delphi unit, which is the only FDA approved blood flow restriction cuff that's out there at the moment. And so this unit, like I talked a little bit about earlier, is actually able to measure what it's going to take to restrict the amount of blood flow that we want. Just like your blood pressure cuff, this is going to take the blood pressure and tell us exactly what it's going to take to actually cut off the blood flow, but then it's going to calculate what pressure we need in order to be able to exercise with it so that we can get into our exercises. So once we've had the measurement of what exactly we need to cut off 80% of the arterial flow down into the limb or the blood going down into our leg, we're good to go. So we have our settings, we know that's gonna be on the leg, and we know that a typical round's gonna be about 5 to 8 minutes. And so what we'll do with this first exercise is we're just gonna start with a basic straight leg raise. And so we'll have her bend the knee here. And with the blood flow restriction, the typical sets are 30. And so as she goes through the first 30, the goal is that we basically clear out all the oxygen that's in the leg. And so by the end of this, the goal is that she is so tired of straight leg raises that we can actually hit deflate, and then she gets that sweet relief where the cuff is no longer on. As you can probably, if you could see her face, it's definitely tough, like I said. And so when she gets that 30, we'll click here. She gets a 30-second rest. In a typical session, I like to do maybe 3 to 5 exercises. If it's someone's first day, I'm gonna do maybe 1 to 3, just to kind of depending. And so, it's definitely a good workout and very effective. We know from all the research that if this does one thing, it strengthens the muscle and it makes the muscle bigger. And that's what we're looking for, especially on on this rehab side. So I also like to do exercises where you're on your feet, whether it's balance. I'm a big fan of squats with this, and so once I get the cuff inflated, it's the same sets. It's that 30, 15, 15, 15, and so what we'll do is we'll have her start on her first set of 30, again with the goals to try to fatigue that muscle out, get all the oxygen out of it so we can actually start getting that muscle burn, and we're trapping all those chemicals in there, as biochemicals. Just a little bit more about the cuff as she's doing that first set of 30 is, if you kind of see in the screen here, this is a little bit different than most of the other blood flow cuffs in that it's going to try to maintain, and it does a very good job of maintaining the exact pressure at which she needs to maintain in order to keep that what they call limb occlusive pressure, the amount of pressure needed to keep all the blood flow trapped in there. And so this thing is constantly working and constantly keeping the cuff tight on her leg, so that we can maximize the effect. And so what we know with research is that if we can maximize that effect, keep it exactly where we want it, then that's where we're going to get the most results. That was my goal when I bought this unit, was to get the best so that I could offer the best.